I'm John Batchelor. This is the John Batchelor Show. Edith Schaeffer's new book is Asperger's Children, The Origins of Autism in Nazi Vienna, focusing on one man, Hans Asperger, whose name is attached to what today has been understood as the Asperger syndrome, about children who have differences with other children. These are arbitrary decisions. I'm following the chronology that Edith follows very carefully with the documentation of Hans Asperger's transformation from a very young and, at this point, permitted into a visionary world of dealing with children who have behavior problems or are, in some fashion, not considered normal. There are many words for these things at the time, but Asperger is observing. However, when the Nazis come in, he makes a transformation into what will become a child murderer. And we now go from the curative education ward, which is where Asperger works, to a place called Spiegelgrund. This is in a larger facility at the edge of Vienna, Edith tells me. She reminds me that we're speaking in German now. That it's Jekelius, not Jekelius. The campus is very large, and there's a photograph in Edith's book of the campus, but there's a particular two pavilions in these 34 pavilions laid out with lots of ivy, pretty much built like the vast campuses at the time for psychiatric wards or people who were wards of the state for a long time. Even orphanages look like this. Edith, the Spiegelgrund that became the destination for killing children, very carefully that worked up over time, but I noted surprisingly, the people of Vienna knew about it. It wasn't hidden from them. There was a demonstration, you note, in front of Spiegelgrund near the pavilions in October of 1940. Was it a controversy in the papers? Did they talk about it, that taking your children to the state for advice if they're having difficulty in school or if the family is broken? Did the people of Austria know that there were children being murdered, and did they try to stop it?
This is one of the fascinating things to me about the euthanasia program, the murder of children and adults considered to be disabled, which is this is the only program of extermination that the Germans protested for people considered to be disabled. And as you point out, there's the example of the protest that was only dispersed by the police and the SS. And as a result of popular pressure, Hitler actually called an end to the euthanasia program in August 1941. And this was, completely out in the open. There were leaflets disseminated calling for an end to this. The program did continue in secret, but to me it speaks volumes. The Germans were willing to protest the killing of other people considered to be German, Aryan, and not protest the killing of other populations.
It wasn't just killing. It was experimentation. It was torture. It was a grotesque abuse of the Hippocratic Oath. It was vast. It was well known, but we're concentrating on Hans Asperger. So I've written down the cases. Edith has provided a number of them, but just a few to evidence what we're talking about. The decisions that he was making and that people and the University of Vienna Children's Hospital were making, and that couldn't be hidden. All these years later, they're documented. Asperger calls these difficult cases that he sends to Spiegelgrund, or he sends to a halfway to Spiegelgrund, another hospital that then forwards or then pushes the children onto Spiegelgrund. What did he mean by difficult cases? Did he ever fill that out, Edith?
Difficult would mean a child is ineducable or unable to learn, and this is a phrase that he would use. Once you deem a child unable to learn, they're not supposed to go to a reform school or enter therapy. They're supposed to be admitted for what he would call stationary observation. And the purpose of observation in the language of euthanasia is observation to determine whether or not the child could ever be useful and marked for death. And he published to the effect that the most difficult cases should be sent to Spiegelgrund. He gave a talk publicly, and then this was in the Munich Medical Weekly, where he used the vocabulary of the euthanasia program, recommending treatment in quotes, which is a euphemism people used at the time for murdering children. So this, again, was something that was very much out in the open, and it was understood by Asperger and his colleagues what difficult cases meant, and that these were children who were unable to be productive members of the folk.
I'm following Edith's reporting here. Hildegard Landau, 16, 1943, epilepsy. Asperger recommends she's sent to St. Joseph's Hospital at Frischau, but she's sent on to Spiegelgrund, where they torture her, and she's allowed to die because she's ruled ineducable. Could Asperger have not known that that was going to happen?
Well, as you had mentioned before, there are children he transferred directly to Spiegelgrund.
I know. I started with a difficult case because she's 16 years old. Yes.
So the case of Hildegard Landau, he transferred to one of the feeder institutions.
Mm-hmm.
There were a couple institutions that were main feeders of Spiegelgrund. So not only was he transferring children directly there, but also to St. Joseph's at Frischau and another institution. And so the dangers of even entering the system were well known, and he would choose to institutionalize children and send them into this system full knowing and issuing them diagnoses that could be death sentences. It also matters what he puts in their report. And if you put a damning diagnosis such as ineducable, you can guess what will eventually happen to the child.
3 years old, Richard Draskovic. He has what apparently was observed to be, we call now, Down syndrome. He's sent by Asperger to Pressbaum, another facility, and Pressbaum sends him on to Spiegelgrund, and he's killed. He's ruled incurable. Was that a word that they used for Down syndrome at the time, or they call them incurable as opposed to ineducable, and therefore we have no use for them?
Absolutely. Down syndrome was one of the categories that was a blanket designation to kill. There were other conditions such as deafness or blindness or manic depression or schizophrenia that were also blanket designations. And Down's was absolutely, you were incurable, and that was that. You were basically a drain on the state.
Right. Asperger insisted that his understanding of autistic psychopathy was entirely male, correct?
Correct.
So this doesn't make any sense. It's like he's broken his own vocabulary.
He has broken his own vocabulary. He wrote that in over 200 cases of autistic psychopathy he had seen, 0 were girls. I can think of a couple of reasons he might have used that term. He might have been using autistic as an adjective, but I didn't see him use that as an adjective elsewhere. But also he was making a case that these autistic boys had superior intelligence, so he might not have wanted to consider Hildegard as an autistic psychopath because he was trying to make the argument that these boys were superior, and so it would make sense that a girl couldn't possibly have that condition.
We've spoken of 3 children who were destroyed, transferred by Asperger to a halfway spot, and then on to Spiegelgrund. However, Edith offers 2 examples. Herta Schreiber, who's very young, has meningitis, and she's killed in 1941, and Elizabeth Schreiber, who has limited language. She's ruled feeble-mindedness, congenital feeble-mindedness. That seems to be one of the inarticulate diagnoses that are capable in Asperger's ward. And she's experimented on by Heinrich Gross, the physician at Spiegelgrund. Could Asperger not have known when he transferred Elizabeth that she was going to be tortured?
Well, this is a case where Asperger actually recommended Spiegelgrund, and then she was sent for logistical reasons to St. Joseph's. And so